He had someone who was a bit of tape on someone's ankle yesterday. I looked like Charlie had his ankle.
Charlie did.
So one of the techniques that's been useful now. Someone in the Mater Hospital actually did this study. It's a small, like a case series, I think it was. But people with an ankle sprain had, and for fuck's sake, don't ever say they took patients, but people with an ankle sprain had, they found a little movement, a little asymmetry of where the fibula sat compared to other people. Now, there have been other studies that have used manipulation, the distal and proximal tibial-fibular joints as part of rehabilitation for ankle sprains, and found it had no additional benefit whatsoever. So they did manipulate in a randomized control trial. You'll find it in they manipulated people and rehab the ankle, or they just rehab the ankle, and they all had the same outcome. So the manipulation has no added effects. However, there's some evidence behind this Mulligan technique here that it has proven useful. The idea is that the fib has come forward and down a little bit as part of that inversion sprain event that's happened. That's the idea. Don't ever say anything, but that's the idea. And you're going to put a glide posterior and superior back that way and get the patient to do whatever the painful movement is. Like so, okay? So I'm going to push that back. No, you do that. Yeah. This diagonal here, I want you to do for me. Got it?
So you're pushing down on the fibula.
I'm holding that there, the fibula. I'm pushing the fibula superior and posterior. This angle here is my thing out there. Off you go. You find it in your Mulligan book a bit of stuff, and you'll find a bit of research online around that. It's a sustained glide. How it's actually working, I mean, when you do these, you've got limbic system activation. They're good brain scans, people getting stuff, and there's lots of stuff happening in your brain as well when you're getting them over, right? And Mulligan technique as well, especially. Now, having done this for a few reps, you then put your bit of hyperfix on around there, wrapping it around, pulling it that way. You put your zinc oxide on, push it back, tape it around in that position, leave it on for a while. Now, my position on putting tape on people is this. Is it adaptive or maladaptive? If I broke my leg earlier on today, would a cast on my leg and a pair of crutches be adaptive or maladaptive as a coping strategy? Would they be helpful or unhelpful? Adaptive. If in 3 years' time we're walking down the street here, we're at your reunion, and I walk down, oh fuck this bollocks here, and I'm on my crutches, and I have an air cast on, hey man, and I have an air cast on, I'm walking down the street, and I say, oh, I'm nearly there now, it's getting there now, the leg, it's getting there, I'm putting a bit of weight back onto it now. Has my strategy been adaptive or maladaptive? And it's kind of like that, so it depends on where you're at. So a bit of tape on it, fine. Now again, there is evidence there that actually, the only thing we can actually really stand over with ankle sprains is putting a laced brace on the leg for about 6 months after the sprain. That's in your clinical guidelines. You look at them and send them on if anyone's interested in that stuff. But that's pretty strong evidence that that's a good idea. Whether that's going to give someone confidence back in their ankle, maybe not on its own. So some interventions to give them back a bit of confidence and sense of control over their ankle would be a really good move. If you're going to use the brace, use something else as well. Make sure they're getting the confidence. You're treating this bit as well, and you're treating that self-efficacy and the confidence as well. Remember, it's an important thing to treat. But there is evidence that putting the lace brace on is useful. So,
but not all the time, just...
No, just during mass play, not all the time, no, just during mass play.
Not mechanically. And not mechanically. Not useful mechanically, so it's still not for to heal the process, or it's
protecting the ankle actually. No, it actually stops them getting another sprain. Now here's the thing, do they actually get secondary sprain? It's a complex thing, and when we do studies and we don't include this bit, which most studies don't, the most risk factor studies just look at the mechanical, we're kind of losing a big lump of the picture. We don't see what's going on. Do you know, we're looking at it in 2D and we're not seeing what's happening. So I think for me, when we look at a risk factor study that doesn't include the psychosocial components, effectively doesn't assess for them in a screening tool, I think we're just fucking around. You know, we don't really know. We're missing such a big part of the picture that we don't really know. So a lot of the research we've done, we kind of need to do it again and add in that component, if that makes sense, and a bigger samples. That's a research perspective anyway. All you need to know is this technique. Push that back into the wiggle of foot. That's all you need to know right now. Let's keep it simple. I'll run out of time. You've seen me get distracted so easily, don't you? We'll have a cup of tea and talk about it if you want. Now, next up. This, you don't have a cup of tea, man. Fuck you, son. So, this one here, this way here. If you're getting that pinching and a pinching in here, you can use this, and you should slide back up there a little bit. This mobilization, you covered this yesterday, you did a little bit of medium one, and do some accessory mobilizations there. We've got a couple of Mulligan techniques we can do.
You kind of plantar and dorsiflex the foot at the same time as doing that.
Yeah, you can do that too. As a passive one. I quite like the mulligan ones for that, and the Charlotte curl joint, one of the mulligan ones is this here, where I'm going to put a glide backwards, posterior glide here, and we'll get you to do that up and down like that. Okay, you do that, so it's an active movement for you. Okay there? And we work that with the glide. That's for restricted plantar flexion. For restricted dorsal flexion, can you have, anyone got a belt for me?
Yeah, we have, you know.
Love it, we have. Did you get that?
There's a story behind it.
I don't know if it's a family or romance, I can't tell.